Hello everybody and welcome back to another episode of Nursing Surgery Day 6. Today, I, your nurse Haiqal, will be demonstrating to you on how we should take care of a patient who is post-operational on an inguinal hernia surgery. Good morning, sir. My name is Haiqal and I'm your nursing assistant for today. Are you comfortable with that?
Yes.
Sir, may I know your full name as well as your date of birth?
My name is Raziman Umar. My date of birth is 1st of January 1970.
Alright then, it checks out. Thank you, sir. Okay, sir. Do you know where you are right now?
I'm in the hospital.
Alright. And do you know what happened to you?
I just had a surgery on my abdomen.
Yes, sir. So how are you feeling right now, sir?
I'm fine.
Very well then. Now I will be checking your vital signs and I'll begin by checking your pulse rate. May I have your hand, sir? Thank you, sir. Your pulse rate feels fine. Now I will be checking your lungs. Inhale, sir. Exhale. Inhale. Exhale. Inhale. Exhale. Very good, sir. Your lungs sound clear. Last but not least, I will be checking your temperature. And your temperature is fine, sir. No fever. Since your vital signs are all okay, sir, I will be checking your surgery site. Would that be okay with you, sir?
Yes.
Very well then. First and foremost, I will need to remove your blanket. And then I would have to remove your shirt, sir. Will that be okay?
Yes.
The area around your surgery site, sir, looks fine. There is no indication of swelling after the surgery. And now I will be opening your dressing to look at the incision wound. If you do feel pain in any of these circumstances, please do tell me. Now, opening the dressing, we can see that the incision site is healthy. It is repairing itself and it is also not bleeding. So this is very well, sir. You're healing good after the surgery. So now I will be changing your dressing. Here is the new dressing, sir. Again, if you feel any pain, please do tell me. Okay, sir. We are all wrapped up now. Now, ladies and gentlemen, we have checked the vital signs of the patient as well as the surgery site, in this case the inguinal surgery site, and it all checks out fine. But the last precautionary step that we have to take, which is the third step, is for checking for a pneumonia infection, because we all learned about nosocomial infections, so we must check them out on the patient that is post-operative. Sir, since we have checked your vital signs and it is all okay, I've checked the surgery site and it is all okay as well. The last step that we are going to check on you is if you have a pneumonia infection. Will that be fine with you, sir?
Yes.
Alright then, sir. I'll be putting this soft pillow onto your stomach. And I will ask you to inhale, hold your breath, and exhale for 3 times. And at the very last time, sir, I will ask you to cough for me. Will that be fine?
Okay.
Alright then. Inhale, sir. Hold your breath. Exhale. Inhale. Hold your breath. Exhale. Inhale. Hold your breath. And cough for me, sir. Very good, sir. Thank you for your cooperation. Now that we're done with all of the 3 steps, which is first checking for the vital signs, second checking the surgery site, third is checking for a pneumonia infection. Now we have to change the position of the patient to avoid any bed ulcers. We learned that we have to change a patient's position for every 2 hours ideally to avoid any bed ulcer formation, because the patient isn't moving around. Alright, sir. Now I will be moving your position laterally towards your left to avoid any bed ulcer formations on you. Alright?
Okay.
Now I will remove your blanket. Once we have removed the blanket, we can now change the position of the patient. Sir, I will be using the blanket underneath to support myself and yourself when we change your position towards the left side of you. And on the count of 3, I will move you laterally towards your left side. If you do not feel supported, you can use your right arm to hold onto the railing. Alright?
Okay.
So 1, 2, 3. Very well, sir. Now the patient is in a laterally positioned towards the left. We have finished our consultation. The last thing to do is to put back on the blanket and the patient can continue resting and recovering. Alright, ladies and gentlemen, and that is it for today on how do we take care of a post-operative patient who has had an inguinal surgery done on them. Special thanks to today's patient, which is my father. And remember to share, like and subscribe the video, as well as hit the bell so that you are notified whenever we upload. Now see you in the next episode.